feel free to share them with the group. But otherwise, sit back, relax, and just enjoy the show, because I've got some questions that I've already been asked, which I will relay now. Any specific advice or tips for massaging scars, as in any guidance on method or frequency? Yeah, people often ask this about, because I say massaging the scars is really important. And so my advice is kind of like circular movements. Circular movements, use your finger. You don't have to use any sort of device or anything. And try and make it blanch. So depending on where it is, if you can kind of press against it, if there's something hard to press against, try and make it blanch, try and make it go white. By the way, this is usually after about 6 weeks. So once the wound's healed. So I don't do this until the wound's healed. So once the wound's healed, then, get your massaging it. So people kind of say for how long, but it's literally moments. I don't even think it's measured in time, because they say like a couple of minutes. I think a couple of minutes of massaging scar would actually be quite a long time. So just moments, really. 2 or 3 times a day, depends on where the scar is. Obviously, if it's on your hand or on somewhere accessible, you can do it more often than that. If it's somewhere on your body, then you probably can't do it that often. So maybe morning and night. And you're just trying to help the redness, help the firmness. Often they're quite sort of tight and pulled in, and massaging just helps it to soften and relax. They soften and relax anyway, but massaging just helps it get there. So yeah, circular motions, pressure to make it blanch, and some kind of moisturizer. If you are using a normal moisturizer for your body, then go with that. If you, I don't think there's any evidence to say that one kind of moisturizer is better than another, so I don't think you need to particularly use any specific ointment or a cream, or Nivea or E45 aloe vera or whatever. Any sort of moisturizer will be good, and if you normally use a moisturizer, then that would be fine. I don't think there's any evidence to say that one moisturizer is better than another, so if you've got one that you think is good, then go with that. And that leads me to my next question, which is, do you recommend using Skinuva scar cream to help my scar following mole removal on the nose? I mean, I've had a look at this, and there's a lot of scar reduction treatments. This is one. It's quite expensive, and I'm not sure. I didn't kind of see any evidence to say that it was better than time. And I know the patient who's asking for this this question, and I know that your scar is less than a year old. So really, within a year, then I do think moisturized massage is good. But I think many scars will improve in the first year, and I think that a lot of situations you'll get someone saying this scar is really good, look at this scar, and we use this scar cream on it, and look how much better it is 6 months later, when a lot of scars, pretty much all scars, will be better 6 months later if it's within the first year. So what you really want to see is say, look, we did this to one half, and we did this to this to the other half, and this half is better than that half. I think if you are just putting the cream on and saying, look, 6 months later it's much better scar, it's like, well, most scars will improve in that time. Same with a lot of treatments for scars. They kind of say, look how much better it is following 3 applications of this ointment or this laser or this or that, when in fact it's time has happened as well, and time will improve all scars. So I'm not sure if there's any evidence for it. The thing about these creams is they are quite expensive, and I can't particularly say that they are good, because I don't think there's any evidence for them. But I can't also say that they're bad. I don't think they'll do any harm. So if you feel that they're good, and sometimes the fact that they're expensive can actually be make you feel that they're good and make you feel they're better, I think there is definitely a psychological element to it. And so by all means do try it, but don't go spending your money on it thinking that I've recommended it, because I don't particularly recommend any particular scar. What Sarah's got something going on here. Oh god, what does a consultation cover with regards to my daughter's tubular breast? Will you be able to give full details of what will be done? Can it be addressed in one operation, etc.? Yeah, so So what a consultation involves is history examination and talking about the options. Tubular or tuberous breast is a difficult problem, and so there will no doubt be some discussion as to how it's done and what is done and whether it can be done in one operation. For sure, that will be discussed. When people come for, certainly for breast surgery kind of consultations, I usually say, there's often a lot to talk about, and certainly with a tuberous breast deformity, I'm sure there'll be a lot of issues. And so I always say it's best to come back. We only ever charge for the first consultation, so it's usually best to kind of go over things again, because I'm sure there'll be questions asked or questions that come up in the time after the consultation. And so it's always best to come back. So it kind of varies how much and how far we get on the first consultation. I'll go over everything, but how much will go in, and it depends on how much you know already, and whether you're got an idea what you want, or you're not sure as to how far all along. Sometimes we get to a really clear plan at the end of the consultation, say, right, you can have this and that, and that's really clear. And sometimes it's not so clear, and think, oh crikey, I'm not sure whether I should have an implant or not an implant, or a lift or not a lift, or whatever, have one breast operated on, or two, or whatever it is. And that's fine too. So I say, look, just got to think about it and come back and go over it all again. And the second consultation is often easier, because you've got an idea from the first consultation. So what's involved is taking a history, getting an idea of the story, examining you, getting an idea of what the issues are, and then an idea of your anatomy and what could be achieved, and trying to get an idea of what sort of thing you're trying to achieve, and trying to convey to you what sort of thing we can achieve, because that is the trick with this sort of stuff, getting those two things aligned, which can sometimes be a challenge, sometimes not so much, but getting you and we on the same page as to what is possible with surgery, what surgery can do, and then an idea of what sort of surgery would be the thing to deliver said results. Is there a long waiting list, or is July for procedure okay? We are restricted due to university, etc. If it's me, Sarah, there isn't a long waiting list, because I haven't been doing so much of these ops recently. In fact, the last 12 months or so, I haven't been doing any GA sort of major operating. I've been spending time trying to build up the business, build up the clinic, and it's only just recently, just before Christmas, that I said that I would be starting to see new patients. So I'm not actually seeing that many, and I'm not really trying to sort of promote the aspects of me doing it. So I'm trying to kind of promote the other guys. So no, I haven't got a waiting list anymore. I'm trying. I'm not seeing that many people, and I'm not. So I haven't got much of a waiting list anymore. What was the question? We are restricted due to university. Is July for procedure? Yeah, July for procedure is fine with me. And to be honest with you, Amy knows all about this. So if you contact the clinic, you've probably spoken to Amy. Amy knows all about dates and stuff like that. So the waiting list is not a thing anymore, because I'm not seeing not promoting myself as much as I used to. So what have we got here? Do you have any advice for microneedling following mole removal on the nose? Not really. I don't really know much about it. I don't do it. I don't offer it. I know it is a thing, and they say that it increases collagen or something, and increases. I've got to be honest with you. I don't know how this is going to come across, but I think a lot of this stuff, if you believe it's good, then I think it's good. And I hate to sort of fall back on the placebo response, because I think the placebo response is a very real thing, and I think is a valuable response, and I don't think we should underestimate it. So I'm not saying there isn't physiological reasons for these sorts of treatments to help, to work. But I'm saying if there is an element of placebo, then so be it. And the thing about placebo response is the more kind of invasive the procedure, the stronger the placebo response. And, microneedling, little needles might sort of hurt a bit. That's going to increase the response. And so maybe it will work from that. Maybe there is a physiological aspect to it. But I don't do it. It's more of a sort of non-surgical treatment done by non-surgical practitioners. And again, I'm not sure where the evidence is. I'm not sure if they've done it on half a scar and not the other half to show that it helps, because as I say, I'm always a bit skeptical when they've done it on a scar and then said, look, 6 months later, the scar is so much better, because I can show you scars where 6 months later, they're a lot better, where people have done nothing to them. So I don't know is the answer. I don't do microneedling, but I'm aware that it is a thing. Speeters only does it to talk about the sort of pros and cons of it. Of course, it'll be you. Where do you operate at? So at the moment, where I operate at is most of my stuff. Terry, is that Terry? Is that you, Terry? Do you not know where I operate at? Most of my work is done at the clinic, but that's local anaesthetic. But I'm guessing you're referring to general anaesthetic cases. So I'm doing it at Burcott Hall in Bromsgrove is where I'm currently doing my GA stuff. Priory and Parkway seem to have gone by the wayside, it would seem. So I'm doing it at Burcott at the moment is where I'm operating at. Like, what have I done? Pressed a button there. Yeah, so in Bromsgrove, not so far from the clinic. Do we offer surgery for brachydactyly? Brachydactyly, wow. Okay, so brachy means short. Dactyly means kind of fingers. So brachydactyly, oh God. Brachydactyly, short fingers. Of course, it's me. Hey, Terry, do you know where I operate at, Terry? So, yeah, short brachydactyly, short fingers. No, we don't do that. That's a congenital hand deformity that will be done by a hand surgeon. And yeah, that's not the sort of surgery that we do. We are breast, head and neck type surgeons, and we are not congenital hand surgeons. That would be a specific type of plastic surgeon who would do that. And usually that's, well, depends on how severe it is. I think that could be treated on the NHS, but anyway, no, that's a congenital hand deformity that will be treated up by a congenital hand surgeon who will be a specialist in that field. My field is breast surgery. Can you remove a lump after having filler on the face? Yeah, this patient is a patient who got in touch who said, I've got a lipoma from a filler. So I've got a filler and I've got a lipoma where the filler was. So obviously, so it's not a lipoma, that's filler. So so I asked Amy to put this on. So that is something that would need to be treated by the filler person, because that's a consequence of the filler. And this is one of the aspects, one of the things you've got to be a bit careful of when you have particularly filler, because filler is not a prescription medication. So anyone can get filler off the internet and then anyone can inject it. And the problem with filler is it can cause issues. And if you have got someone who's not trained and not able to deal with consequences, then you got a problem. Because if you have something like filler or have some kind of treatment, and then you go to someone else and look for help with the consequences or the complications of that treatment, you'll find that people are very reticent or not too keen to take you on, because it's the responsibility of the person who did the original procedure. And so that's why you've got to be careful if you have someone who's often not even a trained doctor, but certainly not trained surgeons who are doing things like fillers, and they can be significant consequences from them. But the answer is you need to speak to the person who did the treatment. So if you have a lump after a filler to the face, often fillers are temporary. so they're often not permanent. So that's something. But you know, there are specific things you can use to dissolve them and what have you. So there are antidotes, if you like, to filler and what have you. So that's, but that would be, you know, to be dealt with from the practitioner, which is why you've got to be careful with the practitioner that you choose to have this sort of stuff, especially fillers. I mean, it's a nightmare, fillers, because as I say, anyone can buy them and inject them, and they can cause complications. They can cause serious complications. So don't take it lightly. Don't take the practitioner or a surgeon or doctor or whatever it is that's doing it. Do look at their qualifications, and you don't necessarily have to have a surgeon do it. You can, you know, but kind of well, I suppose you don't have to have a doctor. You may have a nurse. You kind of want someone trained in something. You want a trained person to do it, basically. Botox is a little bit different because it's a prescription drug, but even so, some people will get doctors to prescribe it, and then, you know, so you have to have a doctor or a prescriber to prescribe it, and then, but anyone can inject it. So it's a little bit more of a barrier to entry there, because it's a bit more difficult for the man in the street to get hold of Botox, but still not impossible. Whereas the man in the street can get hold of filler, and then yeah, you do get the man in the street injecting it, which could be difficult if you have a problem. And so yeah, we wouldn't help with a lump after having filler to the face. I don't do filler. I don't do Botox. I don't do any of that sort of non-surgical treatment. So as I say, you need to speak to your practitioner who kind of did it. Do we offer a definitive treatment for a cyst or abscess in the groin? So this is a person who got in touch at the weekend who's saying, can we have a definitive treatment because they've had a cyst in the groin, they've got an abscess, it got drained, but they've still got the cyst. And when someone has a story like that, the initial thing is hidradenitis suppurativa, which is a condition of cysts in area where you've got glands, so the groin, the armpit are the classic areas, and you get recurrent infections, and it's a real problem. And it is not just a cyst. So we do treatments, definitive treatments for cysts. We excise cysts, but this is a different thing. This is a disease. Hidradenitis suppurativa is a disease, and it is not simply a question of removing a cyst. It is a more kind of localized disease to the groins, to the armpits, to that area, and so it needs to be addressed from a taking a step back. And the first thing is, are you overweight or a smoker? The vast majority of people with hidradenitis suppurativa are either overweight and or smokers, and you need to get that fixed first. It'll be wrong to try and do any kind of definitive surgery if you are still overweight or smoking, because then that will affect the results of your healing, because these are bad areas to heal and there's potential to give you nasty wounds that don't heal. So that is the absolute first thing to do. And then, to be honest with you, that's it. That normally fixes things up. And then sometimes you do get localized infections which needs drainage or antibiotics or what have you. And then that's it for control of it. It's rare that we as plastic surgeons would get involved. If we were getting involved, the definitive treatment side of things is kind of removing all the glands. So you often do quite wide excisions of groins, of armpits, and it's really for people who have recurrent problems, and you know, it can be difficult to reconstruct those defects. Sometimes you can close them, sometimes you put skin grafts on them. Skin grafts on the armpits aren't great. It can be stiff, can be tight. There's no sweating because they're very dry. So it's quite significant treatment. And so the vast majority of patients don't get to it. You don't get that far. It's weight loss, stopping smoking, and treating localized infections is the mainstay of treatment, and that usually keeps it at bay. And we would only see people for very late stage, and then it would usually be in the NHS. That usually would not be a private operation because it's quite a big operation, risk of needing repeat operations. So it would be probably something that would be treated within the NHS for someone with extensive recurrent disease. Hidradenitis suppurativa, as it stands, the mainstay of treatment is medical, is not surgical. We try and avoid doing surgery on it simply because the reason you got the problem is because it's a difficult area and it's an area prone to infections. And if we start putting big wounds in that area, we are risking giving you bigger problems, basically, because you'll have issues with it not healing. Yeah, good. Just checking my extensive feed. So yeah, not hydroadenitis is not something that we would rush in to do surgery on because it's a mainly medical treatment. So I'm not sure if there's anything else. I think my chicken Kievs are done, so I might have to go and get them out of the oven. I'll be honest with you, I think they might be overdone, but that's my problem. We've all got problems, so I won't dwell on mine. If you have any cues, then please do put them in the chat. Is there chat there? Of course, put them in the chat or email me or message me, and I will do my level best to aid them next week. Same time, same place, or maybe the proper time next week. And but until then, I wish you good night, and see you Friday, Liz. Liz is going to see you Friday. I'm stopping the stream. Can't wait, Liz. I'm counting how many sleeps